Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and thank you for following our channel. If you have never seen us before, I do cosmetic facial surgery in Richmond, Virginia, and facelift surgery and other cosmetic surgical procedures are my passion. I love coming to work, and I love talking about anything that has to do with cosmetic surgery. Today we're going to talk a little bit about scars and scar treatments. And I do product reviews from time to time, and today we're going to talk about the Strata line of scar products: Stratamed, Stratacell, Strataderm. And these are some pretty interesting products, and I've been using them for several years now. And you know, there are a lot of scar products out there, tons of them. Some do something, some probably don't do much, some are a little magic or whatever. But this is the first FDA-approved silicone gel dressing that you can put directly on open wounds. So there's science behind this, and it interested me, and it used to be hard to get. I had to have my patients order it on the internet. Now it's very available, and we carry it in our office, as do a lot of other types of doctors. So first I want to tell you a little bit about scars. When you break the protective barrier of the skin, whether it's a little scratch or a mosquito bite or a surgical wound or an incision or a trauma where you're disrupting the outer tissues, when this heals, it frequently heals with scar tissue. Now, one of the reasons that it does is that the normal skin provides a barrier for what is called transepidermal water loss. So in other words, if we didn't have our protective skin barrier, everything, our muscles and all our deep tissues would dry out. So that's one of the functions that intact skin serves. Now, when we have an injury or a surgery or something that violates that protective layer of skin, then what happens is you have raw area, and then you form a scab. And what happens is you have this transepidermal water loss. So your skin barrier is gone, you're losing water. And when this happens, scar formation is a whole science, and it's a very technical situation. But just to give you the real cliff notes, what happens when you have this water loss is it stimulates certain kind of cells, which stimulate cytokines, which cause fibroblasts to come into the area and produce collagen. And instead of producing just epithelium, you're producing fibrous tissue or scar tissues. So by putting something as a barrier to prevent that water loss, it's very helpful in formation of a cosmetic scar. Now, these are silicone gels, okay? And it's almost the consistency of a hair gel, or almost like a syrup, and they're very pure, they're clear. And there's three products. Now, when I first got this, I was kind of confused, but it's really simple. I'm going to tell you how I use it, okay? The first product is Stratamed, and this is really our go-to product for any open wound. And so all my patients that do eyelid surgery, facelift surgery, patients that come in with lacerations or have lesion removal, this is what we use. And you can put this on raw, denuded, injured, burned skin. So you can, for burns, you can use it for necrosis, you can use it just on incisions to help them heal better. And that is my go-to. And one of the nice things about this is it's clear, so you can see the wound. It is occlusive, so it makes a moist wound underneath, and moist wounds heal better than dry wounds. And you put it on twice a day. So it's really pretty simple. And again, I want to get patients before their scar forms in my surgeries. So we have them use the Stratamed after surgery or with new wounds. Now, Stratacell is another product, and this is basically for fractional laser procedures or procedures where you have some intact epithelium and some that is treated. So like a fractional laser makes little burns on part of the skin, but preserves the other part of the skin. Honestly, in my office, I really don't use this. I don't do much fractional laser. I do a lot of fully ablative laser. And you can use the Stratamed, the previous product, for fully ablative laser. But if you do a lot of fractional laser, this is something that you might want to try, okay? Now, people call the office all the time and they say, you know, I have a scar, what should I do? And if you call a lot of cosmetic or plastic surgery offices, they'll say, well, come back in a year and we'll take a look at it. That's not true. There's a lot of evidence that shows that treating scars early is really beneficial, and early is 4 to 6 weeks after surgery. And that's when I will laser scars, traumatic scars or surgical scars, if I think it's going to be an ungraceful scar. And again, in that raw period of time, we're using Stratamed in my office. Now, the last product is Strataderm, and this is for intact skin. So this is for somebody that comes in, they already have a scar. They got bit by a dog 2 years ago, or cut themselves, or had a facelift, or eyelid surgery. And this is, I believe, the only FDA-approved one application per day silicone scar gel from the Strata line of products. So these are pretty good. You can see these at strataderm.com, and it's been a nice addition to our office. They're made by Strata Pharma. This is how I use them. I've had some really nice results using this, and I'll show you a couple in 1 second. So we're going to go over some cases here. Here's a lady who had some skin breakdown after a facelift. We treated this with Stratamed, and this is a progression over about a 6-week period, and you can see how nice that healed. This is a trauma patient who fell in her kitchen and lacerated her eyebrow, and there is immediate 10-day, 30-day, and 120-day. Here's another trauma patient. This lady fell and really took out a chunk of her lip, and we weren't able to sew it because there was so much tissue gone. So we treated it with the Stratamed, and this is a poor quality picture, but the patient sent it to me on her phone, but you can see how well that it did heal. Here's a patient who had a basal cell on her chest that was treated with 5-fluorouracil, and that is the progression over 6 weeks. Now here's a patient that had, this is when we first started using the Stratamed, and we put it on the right side and not on the left side, and I couldn't believe what a difference it made. Now, I'm going to talk about that at the end for a second. Here's a patient that had a dehiscence from a blepharoplasty where the sutures came apart. Another patient, a little suture line dehiscence from the facelift. So I use this on any open skin. Here's a patient I've been treating for a giant nevus, and we've removed this and lasered this. And so this is one of the times I've used Stratacell, because we're doing fractional laser resurfacing. Otherwise, I'm using Stratamed. Here's a big exophytic lesion that I took off this patient and treated her with Strataderm. And also, I do a lot of mole removal with radio wave surgery, and here is a patient that we treated with Strataderm. I don't have an after picture on that, but it works well for any time that you have open skin. And here is a final case that I want to show you. This is a gentleman who shut his car door, and the corner of the door caught him in the forehead and had an avulsive wound. So again, there are no wound margins here to close, and this is a great place for an occlusive healing scar cream. And this is over about a 7-week period without any wound closure at all. We'll go back and laser this, and I think it'll be undetectable. So I use this in my practice. I've showed you some ways in which I use it. I'm not purporting that this is a miracle cream, but I do think it has good science behind it, and it's worked well in my hands. And I showed you a patient earlier where I did scar cream on one side of a facelift on an African-American patient and not on the other side, and the other side developed keloid. Well, obviously that is one case, and again, I don't guarantee or purport those results on all patients, but you do see how I use this in my practice, and it's a valuable adjunct to scar treatment in my practice. So we're going to be putting some Stratamed on our 24-hour facelift incisions and blepharoplasty laser on the lower lid and the upper lid incisions. So Lauren has some on her hand, and you can see it doesn't take much. Just a little bit goes a long way, a couple drops. And we're going to put it on her eyelid incisions and on her laser. So let's go ahead and do that.
Try.
And we do it twice a day, and it just makes a little coating, and it dries on there. And if she turns her head, we can do her facelift incision. Hillary. Okay. Same thing here. So we're just going to kind of coat the incision. Put a little bit more on the front there on the lower part, will you, please? There you go. So simple as that.